Good morning, good afternoon. Thank you for joining us today. As always, I am joined by Dr. Morrison, our Chief Public Health Officer, and she will be giving us the most up-to-date COVID information in a few moments. I just wanted to begin by saying that today is the first day where our Vax Pass is required in some settings across the province. I want to reiterate that we view this as a time-limited measure to get us through this fourth wave of COVID, and something that is taking place not just in P.E.I. but across the country. It's important to understand that the Vax Pass will help us prevent having to implement further restrictions and keep our children participating in sports and recreation, keep our students in the classroom, keep our businesses open, and keep our lives as normal as possible in this fourth wave of COVID, in particular with the Delta variant being what it is in this region and in the country. Like other measures we have implemented in the past, like contact tracing or operational plans, we know that we need to provide an opportunity for our communities and businesses to learn, to adjust, and to adapt. And we will do that in the days ahead and do whatever we can to help along the way as this gets fully implemented here within our province. Like all of the steps that we have made in this journey together, we will go day by day, we will adjust as we need to, and we will focus on what is most important, and that is keeping as many islanders as safe and healthy as possible. We know this isn't easy for anyone. We understand that. Dr. Morrison and I understand that. And as this pandemic evolves, we will continue and we must continue to evolve with it. And we've done that here in P.E.I. And in spite of some of the many challenges that we have faced here together, I am proud that we remain the envy of the country and how we've handled COVID, even in the full, in knowing in full that it has not been perfect and it has not been without some challenges along the way. But we've done a good job. We need to continue to do a good job. And I continue to ask for the support of Islanders who have been doing an incredible job in keeping us all safe and healthy here during COVID. So with that, I will turn it over to Dr. Morrison for a full update on COVID, and then we will open up, as we always do, to questions from our friends in the media. So.
Thank you, Premier. Good morning. I actually think it's good afternoon now, and thank you for joining us. As the Premier mentioned, I'll briefly talk about the epidemiology, boosters, booster doses of vaccine, the test or vaccinate policy, and of course might mention Halloween for all our ghosts and goblins who are awaiting that information. There is one new case of COVID to report in P.E.I. The individual is in their 50s with a history of travel outside of Atlantic Canada. Contact tracing is complete and the person is self-isolating. We currently have 9 active cases and 303 cases since the pandemic began. We do have 3 public exposure notifications as well. Friday, October 1st, the Lone Oak Brewery, 103 Abequit Boulevard in Borden-Carleton between 3:15 and 4 o'clock. Saturday, October 2nd, the Wheelhouse in Georgetown, 7 West Street in Georgetown between 6 and 7:30. Sunday, October 3rd, Granville Street Diner, 454 Granville Street in Summerside between 3:30 and 5 p.m. Anyone who is at these locations should monitor themselves closely for symptoms of COVID-19, and if any develop, they should be tested at one of the Health P.E.I. testing clinics. In the last week, the number of new cases was up slightly in Canada. Hospitalizations were up 8% and ICU admissions up 9%. COVID-19 related deaths increased by 20%. As a country, we continue to struggle to manage the fourth wave of this pandemic. The Delta variant has become the dominant strain. It is associated with increased severity and may reduce the effectiveness of the vaccine. In Atlantic Canada, cases continue to rise with 987 new cases in the past week. 644 in New Brunswick, 234 in Nova Scotia. We are concerned about the continued resurgence of COVID-19 in New Brunswick especially. Currently, there are 768 active cases in that province. During the 3-day period from Saturday to Monday, they reported 308 new cases. They have 49 people in hospital, including 21 in the ICU. And as a close neighbor, we watch it very closely. And we hope that P.E.I. never has to deal with a surge in cases that results in serious illness that overwhelms our healthcare system. We are beginning to see how transmission within the community is increasing infectious pressure on children in schools across Canada. Children under the age of 12 are at greatest risk of infection because they are not eligible to be vaccinated yet. During the last week of September, and for the first time since the pandemic began, the rate of new cases was highest in the under 19 age group. As we've said before, it is important that we keep the rate of new cases low in the community to support our children remaining in school. The most important step we can take to protect our children is for each and every one of us who is eligible to receive the COVID-19 vaccine. Hospital admissions and deaths continue to occur primarily in unvaccinated or partially vaccinated individuals, with the rate of hospitalized cases being 38 times higher in unvaccinated and partially vaccinated individuals. Since December, when the vaccine became available, 84% of hospitalizations have been in unvaccinated individuals, and less than 3% were fully vaccinated. The remainder were partially vaccinated. People who are not fully vaccinated are more likely to get COVID-19. The average rate of new cases among unvaccinated individuals was 10 times higher than among fully vaccinated individuals. In Canada, more than 27 million people are now fully vaccinated, and serious side effects from the COVID-19 vaccine are extremely rare at 0.008% of all doses administered. The bottom line is the COVID-19 vaccines are safe and can be life-saving. In P.E.I., we continue to make steady progress on the vaccine front. As of Saturday, October 2nd, 94.3% of eligible residents have received at least one dose, and 87.3% are fully vaccinated. Our rates of fully vaccinated in those under 50 years of age continue to lag behind our overall excellent average. In particular, those age 40 to 49, 84% are fully vaccinated. Age 30 to 39, 83% fully vaccinated. Age 20 to 29, 78% fully vaccinated. And age 12 to 19, 75% are fully vaccinated. So our rates overall are probably lead the country, or certainly one of the highest in the country, but our full vaccination rates in those younger age groups are still too low, and we want to continue to emphasize the importance of vaccination in those age groups. In September, in accordance with national recommendations, we began offering third doses for individuals who are immune compromised. We encourage individuals who are immune compromised and require this third dose to visit a vaccine clinic or pharmacy if over 18 years of age. Last week, the National Advisory Committee on Immunization, NACI, recommended that residents in long-term care and seniors living in other congregate settings, including community care facilities, should get a booster dose of mRNA COVID-19 vaccine at least 6 months after the primary series has been administered. Boosting immunity levels in residents living in long-term care and community care facilities who are at higher risk of exposure and serious illness will help to maintain their protection against infection and severe outcomes. NACI's recommendation is based on a number of factors that may contribute to waning vaccine protection in this group, including high risk of exposure in the congregate living settings, high risk of severe outcomes, time since last dose, and a shortened interval of 21 days between the first and second dose when they were vaccinated. In addition, due to a combination of age and health status, residents may not mount the same immune response to vaccination, putting them at a higher risk of severe outcomes from COVID-19. And as well, NACI came out last week recommending the booster dose may be given at the same time as other vaccines, including the influenza vaccine. And this is good news for us, and it will make it easier for individuals to get the influenza vaccine at the same time as the COVID vaccine or to catch up on other routine immunizations. So in accordance with these national recommendations, we'll soon begin providing boosters to residents who live in long-term care and community care facilities in P.E.I. As part of a pilot project, we have distributed 4,500 Lucira at-home test kits to families with young children in rural P.E.I. These kits are to be used to screen a symptomatic child for COVID-19 prior to going to school or to an activity. We had received 5,000 Lucira kits from the Government of Canada to support this pilot project. We've received excellent feedback from parents and guardians regarding the value and benefit of these at-home test kits. We've just found out we have access to a large supply or a bigger supply of rapid antigen tests in the coming weeks. We will be having discussions with the education system to determine how we can allocate at least 2 tests to every child in grades K to 6 in P.E.I. On September 24th, the vaccinator test program was implemented for frontline service providers. And we've gone through the list before, and these include teachers, daycare staff, group homes, corrections, health P.E.I., to name a few of them. And it was implemented for these providers who have prolonged exposure with individuals who are unable to be vaccinated or who are at risk of severe outcomes from COVID-19. The intent of the vaccinator test program is to protect people who are most vulnerable to COVID-19 and cannot protect themselves. Just over 1,000 frontline workers have been identified as unvaccinated or partially vaccinated, meaning they will be tested in their workplace on a regular basis to a maximum of 3 times per week. Under this program, employers are responsible to implement policies to ensure that unvaccinated or partially vaccinated staff test on a regular basis in accordance with the legal order. I know some jurisdictions in the country have opted to make vaccine mandatory for certain groups of frontline service providers. We have decided to, with this vaccinator test approach, and we are confident that it will be one more layer in order to protect vulnerable groups in our province. Staff in our office will be monitoring testing records of employers and overall compliance with the order as we go forward. Beginning last Thursday, September 30th, we implemented increased testing at the points of entry to allow for early detection of COVID-19. Between Friday and Sunday, 8,400 people were tested at the points of entry, and it was a record weekend for testing at our borders. In order to expedite testing at Borden and reduce delays, there are dedicated lanes for P.E.I. residents and also dedicated lanes for high-sided vehicles. We have been testing truck drivers at the points of entry for many months. In May, the Borden Testing Clinic in Dickey Road was expanded to a 24-hour site to provide commercial truck drivers and workers with around-the-clock testing access. Truck drivers who travel to P.E.I. frequently will continue to be tested every 5 days instead of every single time they come into the province. We do appreciate the patience of travelers as we remain focused on increasing testing at the points of entry. A special thanks to the screening and testing staff at the borders and all our partners who are working hard every day to test and screen visitors and islanders returning home as efficiently as possible. The work they are doing is making a difference to all islanders, helping us pick up cases early and reducing transmission of COVID in our province. As the Premier mentioned, today is the launch of the P.E.I. Vaccine Pass. Similar to other provinces in the region and the country, P.E.I. is implementing a proof of vaccine for a time-limited period to help us suppress transmission during the 4th wave of this pandemic that is being driven by the highly transmissible Delta variant. The Vax Pass requirements will be lifted as soon as we can when the risk of COVID-19 is lower. The P.E.I. Vax Pass is an additional layer of protection, allowing more people to attend discretionary events and activities based on all attendees will be fully vaccinated. Individuals will still be required to wear masks and be in cohorts. However, physical distancing within the cohorts will not be required. An interdepartmental working group has been established to lead the policy and operational aspects of the P.E.I. Vax Pass, and I know they've been working hard to support the planning and implementation of the P.E.I. Vax Pass including stakeholder information sessions and a recent technical briefing for the media. As we turn the calendar over to October, I don't know where the months go. Many children and adults look forward to Halloween, and we've had questions already about what Halloween will be like this year. In the coming days, we will issue guidance on the provincial website for fall activities that indicate that Halloween 2021 will be very similar to Halloween 2020, and children across P.E.I. can look forward to trick-or-treating with some slight modifications, just like they did last year. As we look forward to this weekend and celebrating Thanksgiving, I urge everyone to keep gatherings with family and friends small this weekend, and wherever possible, certainly planning outdoor activities. For those planning to travel to visit loved ones, or for families who are expecting visitors from away, I encourage you to think carefully about traveling and hosting visitors. We know that COVID-19 is circulating in all provinces, including Atlantic Canada, and the virus moves when we move. We do know how important it is for families to connect and spend time together, especially for special holidays. There are students studying off-island who are looking forward to coming home, and non-resident students attending P.E.I. post-secondary institutions who are anxious to go back home to spend time with their families on the Thanksgiving holiday. If you choose to travel for the Thanksgiving weekend, please be sure you are fully vaccinated plus 14 days. You should not travel out of the province if you are not fully vaccinated. In addition, follow the public health measures in the jurisdiction you are visiting, and follow the testing guidance when you return to P.E.I. If you develop any symptoms, even mild ones, arrange to be tested as soon as possible. And as a reminder, anyone over the age of 12 who is fully vaccinated and travels to any other province will be tested on entry to the province, and then again between days 4 and 8. Children under the age of 12 who travel to another province will be tested on entry to the province, and then twice, again on day 4 and day 8. School-aged children who return to P.E.I. from out-of-province travel should have a negative test prior to returning to school. And at this beautiful time of year, as we reflect on how fortunate we are to live in P.E.I., we have much to be thankful for. Our children are in school and able to enjoy most of their activities with some modifications. And although we've had over 300 cases, we've had no COVID-related deaths. And to date, our loved ones in long-term care and community care have been spared from COVID-19 outbreaks, and we are able to visit and socialize with residents who live in those facilities. To date, our health system has not been overwhelmed and continues to be there for residents and visitors who need it, including emergency care, critical care, and elective procedures. We have access to a safe and reliable vaccine that is readily available for all eligible islanders and visitors free of charge. And we have the necessary public health capacity to manage the final stretch of this global pandemic with testing, contact tracing, isolation, and follow-up. I wish all island residents and visitors a happy Thanksgiving. This is a time when we are reminded of our attitude of gratitude, and we've talked about it here at different times over the last 19 months and how important it is. We're also reminded that what each of us is doing every day by following public health measures is not just for us, but it is also for others. So I'm very grateful. I'll take this time to say I'm grateful for Premier King, the government, and our partners at Health P.E.I. and the public health team across the province, and our many partners who are doing their part to keep Islanders safe during this global pandemic. And of course, I'm also grateful for my own family and friends, but I'm also grateful for all Islanders, as the Premier mentioned, who have done so much over the last 19 months, and we are going to get through this. And let us continue to be patient and kind as we do get through this last leg of COVID-19. Thank you.
Thank you very much, Dr. Morrison. We will now open up to questions from our friends in the media, maybe starting, who did I start with last time? You first, so maybe. Okay.
Well, we start with me this
now
time.
we'll start with Dave Stewart from The Guardian.
Thank you, Premier King and Dr. Morrison, as always, for taking our questions through all of this. Dr. Morrison, you kind of answered my first question about this is Thanksgiving weekend. There's going to be people traveling to see loved ones, so that question's answered. But you also mentioned there were 8,400 tests, I believe, conducted between Friday and Sunday at points of entry since the testing was ramped up. Do we know of any positive cases that have come into the province? Have the numbers changed at all? Because the reports seem to be that we get each day cases from outside Atlantic Canada. Just wondering, out of all those cases, are there any positives?
Certainly, and over the last week, I think we've reported 9 cases in the last week, or 9 or 10 cases, and definitely a number of those are from our points of entry.
From the points of entry.
And I think there was actually a media story this morning from one of our neighboring provinces about that I just was made aware of, where they indicated they were actually picked up at our point of entry and then turned around and went back after we advised them, and so we, in those situations, we would advise advise the jurisdiction that that there had been a case identified and they were going back to their own province. So that has happened, and I'm speaking about it because I just saw the media story because they spoke about it themselves. But we've 27% of our, just in terms of testing, 27% of our tests in the last week were in those under age 19. And in the last week, we've done a total of 15,126 point of care, or those rapid tests, which include our point of entry, and another 3,747 PCR tests. So we are doing.
Are they the rapid care tests at the points of entry when you're coming through Borden, or is it the swab? Or?
Yeah, those are all what we call their ID molecular-based tests, so we use those as point-of-care testing, and the very good sensitivity and specificity of those tests. And then if but to confirm them, if they test positive there, they need a confirmatory PCR test as well. So that's been we've been doing that for quite a while for those. Yeah.
Follow-up question, I guess. Just wondering about breakthrough cases. Since June, July, have there been, or what has the percentage been of breakthrough cases in terms of fully vaccinated people coming down with a positive case?
So our numbers, I believe, are on the website for fully vaccinated and partially vaccinated and unvaccinated throughout the pandemic. I don't have the breakdown right in front of me. So all our numbers are also contributed to nationally as well. So so when I think I mentioned the national data, those were national numbers and that includes the cases from Prince Edward Island as well, but I don't have the individual P.E.I. ones right in front of me, but I certainly can get those.
And Premier King, maybe you had a thought about the Vax Pass. How are we close to the QR code, or how are things progressing there in terms of not needing the piece of paper?
Sure, I think that, it's been our plan that sometime before the end of the month, in a perfect world, that we would get to the QR code to make it a little bit easier. But as of today, we're doing the paper or present a copy of your vaccine record to start. And as I say, in my opening, is just that, we've made these difficult implementations before. We know there won't be without some challenges or questions. And, Dr. Morrison and I talked yesterday when we went to the contact tracing component for restaurants and facilities, for example, of how confusing that was and how frustrating it was going to be, and then how relatively quickly everybody just adjusted to it and along the way, and we certainly hope that is the case for the vaccine pass. I mean, it's our intention for this not to be a permanent thing. We want this to be removed as quickly and as safely as when it's safe to do so. But I think every other jurisdiction is doing this. This isn't something that Dr. Morrison and I invented to encumber islanders. We don't get any joy out of that, quite the opposite, to be honest. And We're just trying to do everything within our ability to keep as many islanders safe as possible. We've done a good job in that regard, but we're not resting on our laurels. We want to see this through, and that's why we're here today. And I just encourage all islanders to be patient, to be understanding, to use common sense, and to think about themselves, them family, and their community, because that's why we've done so well, because islanders are in that thought process.
Thank you both very much for your time.
Brian Higgins.
You mentioned you've obtained just today or very recently a large supply of testing kits, and you hope to supply 2 to every school-age person in the province. Can you explain the strategy there?
Well, I mean, the children in K to 6 we know are not vaccinated, and we're always asking ourselves, what more can we do to work with the Department of Education and Early Learning to keep everyone safe, and I think having access to some self-test kits at home, and that's really part of the pilot project we did, just making sure there was access in our rural areas so that they didn't have to, it was more convenient than coming into having a test, for instance, in Charlottetown. So this will be just one more way that there would be some access for some additional test kits. So we believe they were shipped today, so I don't know for sure when they'll arrive, but hopefully as soon as they arrive, it gives us a few days to speak to the details with education and the schools and work out how they'll be distributed.
How many kits are coming?
I don't have the total, but I knew we had enough. There's about 13,000 children who are in school, maybe a little bit less than that, but 13,000 children in that K to 6 who would not be vaccinated and in school. So when I heard we were able to get at least 26,000, I want to make sure they get into the hands of families and parents, and I think they'll appreciate that. I know I would as a parent of two of my 4 children are in that age category.
And Tuesday, the regular flu shot program starts rolling out. Mm-hmm. You've mentioned, is it okay for people to get their flu shot close to the COVID shot? Because the pharmacists tell me usually they want to wait 3 weeks.
Exactly. So, and that's why this new advice out of NACI that came in on Friday has meant that we can, if you have your COVID vaccine one day and next week you want to get your flu vaccine, we can do both, and they basically can be co-administered, so you could conceivably get both on the same day.
And you mentioned 3rd booster shots for long-term care residents. Mm-hmm. Are other groups, is that the 3rd booster shot going to be expanded to other groups?
Well, I mean, we already have previously announced the 3rd dose boosters for those who are immunocompromised, and NACI has recommended now long-term care and other seniors living in congregate living settings, so that would include our community care facilities, and I think they're also looking at the evidence for other groups like healthcare workers, and particularly those who had a shortened interval. So we're just waiting for further evidence and review of that evidence by NACI.
Thank you.
Yeah.
Thank you, Brian. And now our online.
Brittany Spencer, CBC. Hello, everybody. My first question is about the Vax Pass, specifically when it comes to organized sports for people under 18. Now, spectators, parents, and coaches will have to have proof of vaccination to be at those events, but I guess athletes under 18 will not. I'm wondering why that is.
Do you want to start? Sure.
Sure. So, Brittany, thank you for the question. So I think at this point, Newfoundland and P.E.I. both have a similar approach to that group 12 to 18 for those participating in sports and other activities that are really taking place outside of school. And recognizing the importance of the physical and mental health and the value in participating in these activities. We also recognize that some youth in that group, 12 to 18, it's not easy for them to choose whether or not to be vaccinated, and so we are balancing that with the concern around having everyone vaccinated to participate. So we actually are looking, I know, and having discussions around moving to potentially the Nova Scotia approach, where everyone in that age category must be vaccinated, and so we are certainly having some discussions around that as well. So. And if that happens, we'd certainly give families and parents advance warning of that change. So.
I don't have much more to add to it other than I do think there's a fine line that we're trying to walk throughout all of COVID, and Dr. Morrison has outlined a lot of it. And I think there are many kids in this age bracket who don't have a choice in terms of getting a vaccine. I think their parents or guardians, if they don't have it, have decided they don't want them to have it for a variety of reasons, and I feel they're kind of unfairly impacted in that regard. So we're trying to do everything we can to keep some kind of normalcy for those kids as well. But as Dr. Morrison has suggested, that, we'll follow this closely. We'll work with our counterparts and see how it's going in other places. And if we need to make changes and she advises of it, then I would be supportive of that.
Okay, thank you very much. My next question is about testing specifically for children under 12. With testing sort of ramping up, I'm wondering if parents will be able to request the gargle test for kids moving forward, and if so, how they can do that.
Hi, Brittany. So we've been talking on and off about the mainly we've been talking about gargle tests with the testing group for, I think, the last year. And it is used in some places a bit more than here, but some of it has to do with the confidence we have in its sensitivity and how well that test basically works. We have some used it on occasion and for certain circumstances for the saline gargle test. For much of the testing, I think right now that we're doing, especially with all the self-test kits, the testing at the points of entry, they're really very low Nair tests. They're not deep, they're not invasive tests, and certainly they're very well tolerated because they're not the PCR tests that are deeper. So we're actually getting very good compliance with some of those tests. So we'll continue to have the discussions. They're not widely available in terms of the saline gargle, but they have been used on occasion if we need to.
Okay, thank you so much.
You're welcome.
Thank you, Brittany.
Gabrielle Drummond, Radio-Canada. Good afternoon to you both. Ma question, c'est en français pour la docteure Ed Morrison. Alors, docteur Morrison, aujourd'hui, on a le passeport vaccinal qui entre en vigueur, la preuve de vaccination. Mais avec ce passeport-là, est-ce qu'on pourrait peut-être se débarrasser d'autres mesures de santé publique, par exemple le port du masque à l'intérieur des restaurants? Parce qu'uniquement avec le passeport vaccinal, on n'aura que de personnes pleinement vaccinées dans des restaurants. Est-ce qu'on pourrait lever cette mesure-là du port du masque?
Bonjour, Gabrielle. Alors, avec le passeport vaccinal, la mesure vraiment qui change à ce moment est qu'on peut, on n'a pas besoin de garder la distance de 6 pieds entre les tables, au resto, aux événements. Alors, on peut être un peu plus proche l'un de l'autre. Et pour les masques au resto, on ne porte pas les masques, on mange. En tout cas, mais les masques, à ce moment, en mettre encore. J'espère qu'à un moment donné, on peut éliminer les masques à ce moment donné, mais pas encore. Et je ne sais pas si j'ai remarqué que Nouvelle-Écosse, même comme il a commencé leur passeport vaccinal hier, et puis quand même ils vont mettre leur masque et on ne va pas changer cette mesure. C'est une mesure qui on ne veut pas garder pour toujours, mais à ce moment, on gardera quand même.
Ok. Ma deuxième question, c'est par rapport aux hospitalisations, au nombre d'hospitalisations au Nouveau-Brunswick qui augmente. Alors, à votre avis, de quelle façon cette augmentation du nombre d'hospitalisations pourrait avoir un impact ici à Lille? Et s'il y a un impact, est-ce qu'il y aurait encore d'autres mesures qu'on pourrait imposer aux gens qui viennent du Nouveau-Brunswick? Parce que je sais qu'il y a quand même pas mal de mesures, mais est-ce qu'il y aurait d'autres qu'on pourrait rajouter?
Gabrielle, je sais qu'on est en train vraiment d'essayer de vraiment augmenter le testing, d'en parler, l'importance de garder les masques, les autres mesures de santé publique, le passeport vaccinal qui est ici maintenant à l'île Prince-Édouard et au Nouveau-Brunswick. Si vous n'êtes pas vacciné, vous venez de Nouveau-Brunswick, il faut isoler pendant 8 jours et avoir un test négatif avant de sortir. Alors, pour nous, on regarde le nombre de personnes à l'hôpital. Et puis, on sait que Nouveau-Brunswick est un partenaire avec, on envoie des gens ici à Charlottetown, à des hôpitaux, aux médecins au Nouveau-Brunswick. Alors, on veut que les choses améliorent un peu là-bas parce que ça peut avoir un impact sur nous à un moment donné, mais à ce temps, j'espère vraiment juste que les personnes continuent de s'améliorer à Nouveau-Brunswick, aux hôpitaux.
De Lille qui doivent se déplacer au Nouveau-Brunswick pour aller à l'hôpital ou voir un médecin, de peut-être attendre un peu plus, si c'est possible.
Oui, c'est peut-être plutôt une question pour Health P.E.I, mais je pense qu'il faut aller pour votre visite. Ils sont essentiels vraiment de visiter le médecin si c'est à Nouveau-Brunswick. Alors, mais si vous partez de l'île, il faut quand vous retournez, vous avez les tests, continuez de suivre les mesures de santé publique à Nouveau-Brunswick et ici.
Très bien. Merci beaucoup.
Merci.
Tom Bateman, Times and Transcripts.
Oh, hi there. Thank you for taking my questions. Dr. Morrison, you've covered much of this already, but I just want to clarify whether you and your colleagues have ruled out more definitive restrictions around interprovincial travel, particularly with New Brunswick, before the Thanksgiving weekend.
Well, I mean, I had a chance to speak to my colleagues from Nova Scotia, New Brunswick, and Newfoundland last evening, and I mean, I think we all raised the concern about what's happening over the Thanksgiving weekend with increased travel, and I think I spoke to it in the notes about some of those considerations before travel, and then if people do travel, the importance of following public health measures and getting tested when you come back here. And I think that's probably being echoed over the next couple of days in our other neighboring provinces. And recognizing that we are with high vaccination rates, and I think we have, such a good vaccination rate here. Some of the vaccine passport, test or vaccinate policies in place, testing at our points of entry. We're doing all these things to try to make sure that we can continue to see loved ones when we need to, and it is important to continue to be able to do that at the same time.
That's great, thank you. I'm not sure if this one would be best answered by the Premier, but I also appreciate, Dr. Morrison, that you mentioned the situation where, a New Brunswicker said yesterday, he had an asymptomatic case of COVID-19 caught by P.E.I.'s testing regime, and it was a situation where he otherwise probably would not have been tested. It makes me wonder if there are any changes to how New Brunswick is handling aspects of the pandemic, perhaps specifically how rapid tests are being administered, that would give you more confidence when seeing travel between the two provinces. Thank you.
Well, thank you, Tom. Look, I would first and foremost say that I think a big reason we have done as well as we have is the fact that we have been able to do testing and screening at our points of entry, probably at a level higher than perhaps anywhere else in the country. And I think, as Dr. Morrison has said, week in and week out, really, since we've started that whole process, that has helped us, maintain our levels of normalcy here, and also catch the transmission, potential transmission of COVID, before it gets into the communities. It certainly hasn't been perfect. I know that there are challenges with larger provinces when it pertains to travel back and forth, but I think it's probably best for me to leave the New Brunswick protocols to Premier Higgs and his team. But I would say, just from our perspective, that, and I think Dr. Morrison has echoed this many times, that the fact we have been able to do point of entry testing to the extent that we have, even throughout a very busy summer of tourism, has been a real attribute and benefit to us. Yeah.
That's good. Thank you both.
Thank you very much. And anything else here? Yeah, yeah. Brian Higgins, CBC.
What metrics are you using to measure the success of the vaccination passport, and when will we know, how will we know when it's time to ease the passport requirements?
Well, I think I spoke about this maybe last week as well, but and it may have come up in the technical briefing that, we'll, in terms of trying to ease out of the vaccine passport, it will be when we have less disease pressure, certainly as a country and as a region. So I think, and I know I've heard my colleagues talk about it as well, if this vaccination passport and whatever it's being respectively called in different places, can help us minimize some transmission and continue to have functions and events happen during this fourth wave, that's really what we'll hope for. So with COVID, it's been so hard to predict too far into the future, because every time we do, something changes. But certainly it would be, my hope is once we are getting through this fourth wave and we're not seeing the rates continuing to increase and hospitalizations increase in various parts of the country, and the risk of importation and the risk of transmission is reduced, and we have our even higher rates of people fully vaccinated from age 12 and up. And we may, of course, I'm hopeful we'll be able to vaccinate our 5 to 11-year-olds possibly before the end of the year, so, which would be great.
Just to clarify, if the numbers, as we hope, come down in Atlantic Canada, is the Vax Pass still going to be applicable if the numbers are high outside of the region? So are we waiting for the numbers to go down across the board?
Well, I mean, Atlantic Canada throughout this pandemic has had a very, has had lower incidence overall of COVID compared to the rest of the country. But I think we'd have to look at what's happening everywhere, and as well as we've always done that, looked at what's happening in the rest of the country and what's happened here. But it'll also have to do with our vaccination rates here, in particular, certain age groups, and whether or not we can get all our children vaccinated.
Thank you very much.
You're welcome.
Thank you all very much. Thank you, Dr. Morrison, and to all Islanders, if we don't see you before, have a good, safe, and happy Thanksgiving weekend, and you to your family as well.